Pressure ulcer or bed sore are easier to prevent than to treat, but that doesn't mean the process is easy or uncomplicated. Wound may still develop even with preventive, consistent, and appropriate care. Pressure ulcer may develop on stroke patients if they are left on bed or remain sitting for a long time. Due to their diminished sensation, they do not feel that they stayed in one position for a long time. They do not feel the pressure on their skin. That's why it's very important to pay attention to this during the stroke rehabilitation program. Welcome to Sultan bin Abdulaziz Humanitarian City. I'm Sajida Pascual, Staff Nurse of Stroke Unit 1. Join me in seeking holistic approach in preventive and management of pressure ulcer of stroke patients. Now, let's listen and hear from our guests about their expertise on how to prevent and manage pressure ulcer.
Major problems affecting stroke patients is the loss of or diminished sensation in certain parts of the body. This state of altered sensation can lead to the development of pressure ulcer. It is painful localized lesion by unrelieved pressure to the body tissues. Since stroke patients experience altered sensation, pressure ulcer can be a major problem after a stroke. Pressure ulcer may form when a stroke patient is left on bed or on sitting position for a prolonged period of time. Due to diminished sensation, they cannot feel or they do not feel that they have stayed in one position for quite some time. So it is very important to pay attention during the stroke rehabilitation. There are several factors that may lead to the development of pressure ulcers among stroke patients. These are immobility due to weakness or paralysis that hinders stroke patients to turn themselves or to change their positions independently, inadequate nutrition, incontinence, decreased mental status, and diminished sensation. So what can we do to prevent pressure ulcers? First, encourage our patients to have frequent repositioning at least every 2 hours if able. Provide good nutrition, maintaining proper skin hygiene, and the use of supportive devices that will decrease the risk of pressure ulcer formation, such as use of air mattresses, chair cushions, or heel lifts.
Finding the pressure or the ulcer, it is the breakdown of the skin or discontinuity of the epithelial surface. For pressure ulcer, the cause is the pressure itself, and considering the management is to relieve the pressure first of all. Then we will take care of the wound. We will do assessment first for the patient, considering the causes, whether the patient he had malnutrition, whether the patient is paraplegic or there is loss of sensation. And for the wound itself, it depends whether there is necrotic tissue or not, there is infection or not, and the amount of the depth. This will determine the type of the dressing. And there are two ways considering the management of the pressure ulcer. It is either conservative or surgical. For surgical one, it is either if there is necrotic tissue, we need to deprive it surgically. And if the wound took long time and we consider that the conservative management failed for a period of time, then we could go for surgical closure of the wound. This may be flap surgery, skin grafting, and other.
First of all, if we want to prevent pressure ulcer, we should give the patient a liquid dehydration, and we should make sure that he is changing his position and moving so that there will be no pressure on the skin. In case he is overweight or has extra kilos, we should put him on weight reduction diet. Also, we have to give adequate protein. We will calculate his protein requirement and we will give him adequate protein intake through diet so that we will prevent the pressure ulcer. The second thing, we will talk about how we manage the pressure ulcer. Usually if we have a patient with pressure ulcer, we should concern mainly on protein. So we have to give extra protein in this case. We will calculate his protein requirement and give high protein in the diet. And also we have supplement. We can give this supplement, we have arginine powder. This is especially for patient who has wound from stage 3 and 4.
This is our machine which we using for laser therapy. We have here two heads, the big head and the small head. That depends on the area we are looking to treat. But mainly we using laser therapy for wound healing here in our unit. Using laser therapy for 2 weeks regarding to our policy, 3 to 4 times per week. Duration depends on this machine, it's 90 seconds.
So when wearing the splint, there should be extra precaution that should be observed by the interdisciplinary team. Once the splint has been fabricated, the OT will educate the person served and the caregiver for the purpose, donning and doffing and wearing schedule. OT will initially monitor the skin for edema, color, temperature, and pressure areas for 20 minutes to determine redness. If the redness or discoloration of the skin persists after 15 minutes of removal of the splint, then the OT will recheck the skin to fabricate another splint or to modify the splints.